The basic question that I'm seeking to answer is, why do African Americans have lower rates of depression compared to whites, at least according to psychiatric epidemiologic studies? On the surface, it may seem like a good thing, lower rates of depression among African Americans. But I've thought about that question for a number of years now. I wonder if we're capturing the full story. I also look at something called cost of upward mobility among African Americans. There's this idea of upward social mobility. A lot of people cross oceans for the idea of moving up to do better than your parents did, to be able to achieve this dream. And so what's unique about African Americans is that there's some stressors that go along with upward social mobility, like increased exposure to racial discrimination, increased distance from salubrious social support networks, a lack of wealth, and simultaneously, while there's a lack of wealth, also the pressure to give back to family members, community members, friends. So I think those are some of the unique aspects about cost of upward social mobility. And then I also look at the intersection between mental health and chronic disease, specifically depression and diabetes, trying to figure out whether people are, for lack of a better word, masking symptoms of depression and other mental health problems by health behaviors. Being a disparities researcher, I always joke with people and say that ultimately I like to be put out of business. I would love to not have to study disparities anymore. That's the end goal, is to reduce and ultimately eliminate racial disparities in health. When I think about my own experience and different communities that I see here in St. Louis, I think there's something else going on. I think that when we look at everything from substance abuse to violence, I think there's unmet mental health needs there. So I think it's critical to address those needs. Ultimately, being healthy is critical to social mobility. So hopefully by improving mental health, people can have the opportunity to do better in school, to finish educations, to have the opportunity to make more money and things like that, so that they're more likely to be on the pathway of upward mobility.